How old were you whenever you performed your first science experiment? 5 years old? 10 years old? I was about 13 years old when I found interest in science. Hi, my name is Arlette Varela,
And I'm Itzel Revelo.
and today we'll be talking about the CMRI Science Fridays at Wonderscope, a scientific research curriculum through a child's lens. So we start off with the problem statement. How can we increase children's access to and interest in science at an early age?
Children's Mercy is known to be one of the best children's hospitals. Not to mention, they also have one of the most progressive and dynamic research programs in the world. Wonderscope is a children's museum which focuses on fostering the children's curiosity and letting their minds wander. So together, these organizations have created an incredible STEM opportunities for children ages 5 through 13.
The Center School District is one of the school districts surrounding Wonderscope, so we decided to focus on them. According to greatschools.org, Center Elementary students, only 9% of them perform proficient in science, as the state average is 41%. As you can see, that's a drastic change, and you can see it goes on into high school as well. Through many interviews we conducted with educators as well as Emily Thorpe, who is the manager at the Children's Mercy Hospital with health school initiatives, we learned that science isn't a course that's really focused on in elementary. That many students really be introduced into science into 5th grade year, maybe middle school.
This is the Childhood Opportunity Index map, which is measured on a 5-point scale. The darker the color, the more opportunities and resources that are available for students. Here we see that Center Elementary School is in an area which has very limited resources and opportunities, and only 10 minutes away is Wonderscope. Wonderscope is in an area with high to moderate levels. So one of our goals is to take children from Center Elementary to Wonderscope or take Wonderscope to the children. Here we've mapped out the 12-month curriculum project that will be presented to children at Wonderscope every third Friday of each month. Some examples of this are asthma, allergy, immunology, and the social side of science. Some of the things we'll be talking about today is the Goldilocks, precision of medicine, and genomics answers for kids.
Genomic Answers for Kids is a research that is conducted here at the Children's Mercy Hospital. It collects genomic information from about 30,000 patients at the hospital. It helps pinpoint any symptoms through their DNA and assign medication that would help them. It will also help find a diagnosis as well as any medication that would lead into similar treatments for similar conditions. So how do we explain complex medical conditions to little kids? So we thought of an experiment, a strawberry DNA extraction. So we actually had the opportunity to do this with some CMRI employees as well as their children, as I included their pictures here in the presentation. It was actually pretty fun. So in the first picture, you can see that we mashed 2 strawberries in a bag and we added the extraction solution. Then we went on and we filter out the strawberries from the liquid. And as you can see in that last photo, that white substance is the strawberry DNA. And as we explain this to children, that DNA is what scientists and researchers look into whenever they try to pinpoint those symptoms and go ahead and assign medication that would help those children with whatever symptoms that they have. I also put a pamphlet in front of you, and it has the steps of that experiment if you ever want to try it at home.
So Goldilocks, the precision of medicine. This study allows researchers and doctors to come together to figure out what medication and at what dose is just right for the right child. For example, a child with ADHD might need to go through many different medications before finding one that is actually effective. If a child takes too much medication, they might become lethargic or have unwanted side effects. Whereas if a child takes too little of a medication, it won't be effective and the symptoms will still be present. We tied this with slime. So if you add too much activator, the slime will become too stiff, just like a child would become lethargic or have unwanted side effects if you give them too much medication. And if you don't add enough activator, the slime will be runny, just like it won't be effective if a child doesn't take enough medication. But if you add just the right amount of activator, the slime will have the perfect consistency. So today we ask for $2,500 to cover admission fees. 99% of students from Central Elementary School are from low-income families. This would mean that they are eligible for the Museums for All, which means that they would pay $3 per person. This would mean that around 800 students per year would be able to attend Wonderscope and 2 classrooms a month.
In conclusion, this curriculum will benefit all three organizations. It will benefit Children's Mercy as we're engaging communities into research. It would benefit Wonderscope as they're providing hands-on experiments for these children and families. It would also benefit Center Elementary as they are introducing kiddos to science opportunities at an earlier age.
Thank you.